The liver is an organ located in the abdomen under the right ribs. It has several vital functions, including the production of bile, which helps digest fats. Bile flows inside and then outside the liver through channels called bile ducts. When the production or circulation of bile is disrupted, this is called cholestasis. Newborns as well as older children can be affected by cholestasis. When everything is working properly, the liver functions like a factory. It filters the blood to capture and eliminate certain toxic substances. Among these is unconjugated bilirubin, which it transforms into conjugated bilirubin and releases into the bile. Bile circulates through the bile ducts and then leaves the liver to be stored in the gallbladder. When a baby drinks milk or when a child eats, the gallbladder releases bile into the small intestine. Bile mixes with the milk or the food bolus and allows, among other things, the absorption of fats and fat-soluble vitamins A, D, E and K. Since bilirubin is a yellow pigment, it colours the stools. In babies who are exclusively milk-fed, the stools therefore have bright colours. In the case of cholestasis, bile and its components remain trapped in the liver. This has several consequences. The bilirubin accumulated in the liver passes into the blood and diffuses into the body's tissues, causing a yellow discoloration of the whites of the eyes, the skin and the mucous membranes. This is called jaundice. Part of the bilirubin is eliminated in the urine, which becomes dark. When the child eats, bile and its components are not released into the intestine. The stool then becomes pale in color. In addition, dietary fats and fat-soluble vitamins are not absorbed. Because of its detergent properties, bile that accumulates damages liver cells, creating scars known as fibrosis. If cholestasis is not treated, fibrosis can progress to cirrhosis. The liver cells are then destroyed. The liver becomes deformed and hard, compressing blood vessels, and can no longer function normally. In conclusion, complications of cholestasis in newborns and children are severe. This is why it is important to recognize possible symptoms: yellow discoloration of the whites of the eyes and/or skin, pale stools, dark urine, and to consult a doctor without delay. An emergency injection of vitamin K may be essential to prevent the risk of bleeding. Detecting cholestasis in a newborn or child as early as possible allows for an early diagnosis. Among the causes of cholestasis in newborns and infants, there is biliary atresia, which requires treatment within the very first weeks of life, as well as progressive familial intrahepatic cholestasis and Alagille syndrome. If newborn jaundice persists after 15 days of life, conjugated bilirubin must be measured. In case of newborn jaundice, it is essential to check the colour of the stools. If the stools are not bright in colour, it means they are discoloured. Normal stools are bright in colour. Abnormal stools are pale in colour. In the newborn, jaundice plus discoloured stools plus dark urine equals urgent medical consultation. A conjugated bilirubin test must be performed and a vitamin K injection may be necessary.